Good morning, everybody. Very pleasingly, New South Wales has hit 81.9% of first doses, and I couldn't be happier with that rate. We would love to get that as close to 90% as possible, but we know that once we hit 70% double dose and 80% double dose, life will be so much better than what we're all experiencing now. On that second dose, we have reached the 51.9% figure, and as soon as we get to 70% double dose, we'll be able to do all those things that are set out in the roadmap, which we announced some weeks ago. And all of us, I think, are really counting down the days and looking forward to that. So the quicker those of us who haven't had the second jab get the second jab, the quicker we'll hit that 70%, and the quicker we'll be able to enjoy all those freedoms. Very pleasingly, as far as 12 to 15-year-olds are concerned, 17% of that group, so 12 to 15-year-olds, have already received their first dose. Now, there's around 390,000 children in that age group, so 17% in a relatively short amount of time is an outstanding number, and so we encourage parents to support, again, children in that age bracket for getting vaccinated. As a result of these positive signs, the New South Wales Government is pleased to announce that from next Monday, the 27th of September, all public pools will be open in a very COVID-safe way, and those COVID-safe plans will be formalised and made public, making sure that we keep communities safe as much as possible and prevent seeding. But I think all of us appreciate the importance of enjoying the warmer weather and positive mental health and recreation and exercise. And so from next Monday, the 27th, I should say all pools across New South Wales, not just in Greater Sydney, but across New South Wales, will be able to have COVID safety plans and open. Also, pleasingly, in the areas of concern, all the rules will be the same for the rest of Sydney, except for authorised workers and permits. So from tomorrow, very pleasingly, all areas of concern will be equalised, so relating to exercise, recreation or outdoor gatherings of 5 and the like. Everything will be the same across Greater Sydney, except for the list of authorised workers and the associated permits. As you know, we still have relatively high case numbers in those areas, but this is a wonderful step forward in equalising all of Greater Sydney in relation to COVID rules. In terms of numbers, to 8 p.m. yesterday, we had 1,083 cases of community transmission, and tragically 13 people lost their lives, and we extend our deepest condolences to their loved ones, and Dr McAnulty will provide further updates in his health report. So there's not long to go, really. We're talking weeks before we get to that 70% double dose, and I don't want anyone to let their guard down. This is not the time to kick back and think it's over. We are seeing in some of those areas of concern the reproductive rate or the R factor below 1, which means cases are showing, some areas are showing decline, but other areas are still growing. And it's really important for us not to get complacent, but to accept that if we stay the course, if we stick to the rules, we'll be able to really start opening up at 70% in a safe way and making sure that all of us in New South Wales move forward together. But most pleasingly today, just to reiterate that in all those local government areas of concern, all the rules from tomorrow will be the same across Sydney, except for the list of authorised workers and the permit system, and that's because those local government areas are still demonstrating a high proportion of all the cases, and we just want to make sure, before we take that next step to equalising completely, that we are managing the case numbers and obviously the ICU admission. But the best way for us to continue the path we're on is to follow the rules and, of course, to get vaccinated. We need to stay the course, get vaccinated, encourage everyone in our circle to do so. And I'm really pleased, and I want to take this opportunity to thank those communities in Western and Southwestern Sydney who've been doing it tough for so long. They have led the way in our vaccination rates. They have shown us the way in what it means to be resilient and strong. I can only imagine what it's meant for families and what it's meant for households to have to endure those restrictions for such a long period of time. But I hope today's announcement demonstrates our absolute willingness to provide ease, provide support and optimism when we can. And we always said that we'd peak sometime in mid-September. We don't know if we've passed that peak or not. However, the signs are positive, but Dr McAnulty and Dr Chant and the others would say that it's still too soon to call it. but we're comfortable enough to take the health advice in equalising all the rules but for the list of authorised workers and permits, and of course we'll be looking at that as well. I'll now ask Dr McAnulty to provide his health advice, and then we will take your questions. Thank you.
Thanks, Premier, and good morning, everyone. I'll just give an update on the COVID numbers. There were 1,083 locally acquired COVID-19 cases reported in New South Wales in the 24 hours to 8 o'clock last night, and there were 2 overseas acquired cases. There were 99,782 tests performed yesterday until 8 o'clock. In terms of hospitalisations, we currently have 1,238 people with COVID admitted to hospital, with 234 in intensive care and 123 who require ventilation. Sadly, we've seen 13 deaths in people with COVID yesterday, 9 men and 4 women. 1 person was in their 40s, 2 in their 50s, 2 people in their 60s, 5 people in their 70s and 3 in their 80s. 5 people were from Western Sydney, 2 were from southwestern Sydney, 2 were from northern Sydney, 2 people were from Sydney's inner city, 1 was from southern Sydney, and 1 person was from Dubbo. For the 13 people who died with COVID, 9 people were not vaccinated, 2 people had received 1 dose of COVID-19 vaccine, and 2 people, a man in his 80s and a woman in her 70s, both with underlying health conditions, had received 2 doses. 2 people died at home, a man in his 60s from northern Sydney who was being cared for in the community by the Northern Sydney LHD. He'd received 1 dose of COVID-19 vaccine and had underlying health conditions. And a man in his 40s from Western Sydney who died at home, and his infection was diagnosed following his death. He was not vaccinated. A woman in her 60s from Western Sydney died at Wright Hospital. Her death is linked to an outbreak of the Gallipoli Home Aged Care Facility. A woman in her 70s died at the Holy Spirit Aged Care Facility in Dubbo. This is a 2nd death linked to that outbreak in the facility. So we extend our deepest sympathy to the family and friends of the people who've died. There have now been 241 COVID-related deaths in New South Wales since the 16th of June, and 297 in the total pandemic. We've had a number of sewage detections in regional New South Wales without known cases. The places of concern where we've had sewage detections have been Cowra in Western New South Wales, Berriton in the far west south of New South Wales, South Kempsey on the mid-north coast, Ballina on the north coast, and earlier we'd reported detecting fragments in Eden, Byron Bay and Wardell on the north coast, and Balranald in the far west, and Griffith in the Murrumbidgee. So everyone in these areas where we've identified these evidence of COVID in the community, please come forward for testing if you have even the mildest of symptoms. It's very important we identify people with COVID so we can protect yourself as well as your community from further spread. We continue to see the biggest number of cases in southwest and western Sydney, particularly the suburbs of Merrylands, Auburn, Greenacre, Chester Hill, Waterloo, Blacktown, Lanier, Bankstown and the Kemba. Regarding Redfern, where we've seen an outbreak, there are pleasingly no additional cases of COVID-19 identified across the 3 social housing buildings in Moorhead Street, Redfern, to 8 o'clock last night. There remain 20 cases across these 3 buildings, which are home to more than 630 residents. But we really want to thank the community in that part of Redfern for coming forward for testing and vaccination. In recent days we've had just a fantastic response there, and that response is continuing. So Sydney Local Health District will have mobile vaccination teams on the ground again today, visiting 18 social housing blocks in Redfern and Waterloo, and we urge everyone living there to take the opportunity to come and get vaccinated. Vaccination is just so important in protecting ourselves and our families and friends and community. Regarding regional cases, in the Illawarra we've had 64 new cases reported to 8 o'clock last night. On the Central Coast, 20 new cases. In the Hunter, 13 new cases. In Western New South Wales, we've had 8 new cases, and in the far west, 10 new cases. In southern New South Wales, there have been 7 new cases reported, including 3 in Yass, who are close contacts of a known case, 3 in Bateman's Bay, who are part of a cluster of cases there, and 1 new case in Goulburn, who's a close contact of a known case. On the mid-north coast, 3 new cases were reported yesterday. These include 2 cases in Kempsey, who are household contacts of each other, and 1 case in Coffs Harbour, who acquired infection elsewhere. In northern New South Wales, 1 new case was identified in the Lismore area. This case was announced yesterday but included in today's number, and the source of the investigation remains underway. Thanks very much.
Dr. if I could just ask you quickly, earlier this week you said that you wanted to wait until this weekend to figure out whether we turn the corner and the trend is actually reversing in cases. In your expert opinion, we've seen a bit of a drop in cases today and it's been stable this week. Have we reached the peak and is it going down?
It's certainly very encouraging. The numbers today are fewer than the case numbers we had yesterday. We do like to see, we don't ever want to jump the gun, but we do like to see several days of before we can call a trend. But certainly cases overall in the last week haven't been going up. They certainly have stabilised in many areas and appear to be dropping in some areas, particularly Cumberland we called out last week as an area where we've had rapid increase in vaccination uptake as well as good compliance and case numbers coming down. But in other areas of the state, particularly Illawarra and Central Coast, we've seen increases in cases in recent times. So it's not consistent across the board overall, though the numbers are very encouraging, and we'd like to see further days where we're seeing reduced numbers of cases.
Dr. McNulty, the man in his 60s from northern Sydney who died at home, he was being cared for in the community by Northern Sydney LHD. Is there a reason why he wasn't in hospital and was being cared for at home?
Look, I don't have the details of that, but the person was, as I understand it, being cared for in the community by the local health district, but we'll have to get back to you about further information.
Dr. McNulty, in your opinion, with the easing of restrictions that we are seeing, even in LGAs of concern, with mask wearing for fully vaccinated people outside, are we at the point now where we've just got some restrictions in place for the sake of restrictions?
Look, no, look, there have been 3 main areas that we need to keep in place to keep the community safe. That's vaccination, getting rates up, that's the restrictions in the community, and case finding and contact tracing. And those 3 things all play an important role. Their roles may vary as vaccination rates go up, but as the Premier said, it's, we need to keep our guard. We've got a way to go before we can be reassured that transmission and numbers are way down. We're still seeing over 1,000 cases a day. We can't drop our guard at this point.
But in particular, sorry to follow up, in particular, the mask wearing for fully vaccinated people outdoors, in your opinion, at this stage, how effective is that at stopping spread?
Well, for any infectious disease, we look for a multiple barriers. Vaccination is a very important barrier, but it's not 100% effective. Masks are an effective barrier, again, not 100% effective. So putting the 2 together, along with other measures such as social distancing, restriction of movements, all play a role. But as vaccination rates go up, the value of each of those roles will vary. So we want to do everything we can to minimise transmission at this point. So putting in place all those measures is important.
Dr. McNulty, what health advice was given from the public health team that it was time to ease some of those tougher restrictions in the LGAs of concern?
Oh, look, I wasn't directly involved in those discussions.
And what's changed?
You say not wouldn't call it at this stage, but there is these restrictions and areas of concern. That sounds like you are calling it.
Well, the opportunity for us to ease the restrictions in the areas of concern or equalise them in the main with the rest of Sydney is really due in large part to the high rates of vaccination. We've seen some of those communities go from rates around 19 or 20% up to nearly 90%, and that's extremely encouraging. And the health experts also advise that in some of those areas of concern we have seen a decline. The curve is starting to change, but What is always concerning us is that any super spreading event, any people being too complacent actually can change things very quickly. Delta, you can't muck around with Delta. It comes back ferociously. But given the trends, given the risks posed to other parts of Sydney, and given that, in fact, other parts of Sydney we're seeing some number of cases increasing and those areas of concern declining, the health advice to us was that it is safe, but for the authorised workers list, which is the one outstanding thing in the associated permits. So that was the health advice that was provided to us, based on the fact with the high rates of vaccination, and also the fact that in some of those areas of concern, we have seen in the last week the trend declining. I'm not sure if any of you have noticed, but Saturday tends to be the date we get the highest number for a week. Last Saturday we had around 1599, I think it was, and yesterday we had 1,300 or so. So you can see from Saturday to Saturday there's been a slight decline. And we always assumed that September, there's two sets of models that have been publicly spoken about, one which is based on New South Wales Health and Burnett advice, and other models both suggested we would peak sometime in mid-September. So we don't know yet whether we've passed those peaks, but the signs are encouraging. But it could be, you see in other places around the world, the peak go up again if you let things off too easily. But health provided that advice to us based on the high rates of vaccination, the fact that cases in some of these communities are declining, and also because of broader mental health and community support measures as well.
What does this mean for going back to school? Will everybody in Greater Sydney go back to school on those dates that you've already outlined, so starting on the 25th?
Our intention always was that we would provide certainty for school communities and always commence schools going back on that date, on the same date, as much as possible. The government, the health advice and broader government agencies want all of us to move together. So that includes schools going back, including easing of restrictions, including freedoms. We know that can only be achieved if we maintain a reduction in cases in some areas of concern, because there are various options which the health experts can provide to us. So if there's a particular area, it could be a suburb or a region or a town, country town, if there are too many cases by the time we start opening up, those residents might be limited within their own local communities. But our intention is to get cases down by the time we open up, so that all of us can have the same freedom of movement across the state.
Premier, are you confident that you can actually bring cases down when, I mean, cases haven't stabilised that much? We do have high vaccination, but the AMA isn't confident that we can actually drive down cases if you keep allowing more freedoms. They want New South Wales and Victoria to ease down the reopening of the states, and they've also called a national cabinet to do that. So what's your response?
Well, look, this is the tension. There'll always be people that think you're not strict enough. There'll always be people who think you're too strict. And that's why the biggest challenge for us during this has been striking the right balance at all times. And on reflection, we always look to see, did we get the right balance here, and did this make a difference? And we can't automatically tell which restriction had greater benefit or greater bearing on the results, but we're not displeased with where we are, but we know it's precarious. We know that you can suddenly have those cases go back up if too many people do the wrong thing. And that's why our plan to reopen is a very cautious one, and that's why we say to everybody, please don't be complacent, don't think it can't affect you or your family. I doubt there would be many of us now that don't know somebody who's had COVID or don't know somebody who's been very sick from COVID, either in hospital or worse. And that's why the greatest protection we can provide our loved ones and the broader community is getting vaccinated and sticking to the rules. And I do want to reiterate that when you open up at 70% adult population being vaccinated, there's still 30% of the adult population not vaccinated. That's a lot of people. And that's why we're encouraged that at least by the time we open up at 70% double dose, we should have around, I'd love to see towards 90, but at least mid-80s one-dose vaccination for adults. And given the pace of 12 to 15-year-old children being vaccinated, a high rate of that cohort vaccinated as well. So there's a few buffers in there for us. But I don't want to gild the lily. At 70% double-dose vaccination, there is still a major threat. We can't have our hospital system overwhelmed. At the moment, the best advice I received this morning is that the rate of hospitalisation is slightly lower than what we assumed, but the ICU number is about what we assumed. So we are anticipating our worst weeks in ICU and hospitals to be in October, as we showed on that graph. So we're bracing ourselves for that, and we know that our health system is bracing themselves and our staff are ready and geared for that. But obviously we don't want that to materialise, because at the peak there's a lot of people in ICU. The system is technically overwhelmed, although we've planned for it and we know what to do. We don't want to have that continue, and certainly after 70% double dose, we don't want that to continue, because we want October to be the worst month. We don't want November, December, January to be the worst month in terms of hospitalisation, and that can only be managed if we open up in a safe and cautious way.
Premier, some religious leaders have said that they're pushing back on refusing entry to the unvaccinated. Will there be any flexibility around that for religious settings?
Look, we can't risk. Unfortunately, I appreciate people have strong views and people feel various things in relation to vaccination, but we can't afford to have potentially a high rate of those 30% that aren't vaccinated end up in hospital or worse. And as you've seen in the numbers that our health experts read out every day, even if you're fully vaccinated and have underlying conditions, you're still really vulnerable. I mean, I still worry about people in my family who are older and because of their age, as well as others in the community are. So even if you're fully vaccinated, it's always our job to protect the most vulnerable, and we've been working hard, very hard in the last week, in particular in those inner parts of Sydney, and I'm pleased to say that we have seen some increases in vaccination rates in those communities. But we especially worry about those who've been double dose vaccinated but are vulnerable, and those who are vulnerable and haven't yet been fully vaccinated. So 30% of the adult population not having two doses is still a great number, and we can't be complacent. So I can appreciate people expressing their concern, and that's why our roadmap is well thought through, but also does rely on people being responsible and taking personal responsibility. We can certainly control people's activities in regulated environments, whether it's a hospital, whether it's a health facility or whether it's a cafe or a restaurant, but we can't control what people do outdoors if they're not, or within their homes if they're not being responsible. And we just ask people to appreciate that between 70% double dose and 80% double dose is still a very risky time for us. And as much as we want all of us to move together, we don't want to overwhelm the health system.
Premier, Jodie McBurney from the Gladys Institute spoke to National Cabinet on Friday. According to the statement released by the Prime Minister after that, it says, according to the Doherty Institute, when daily case numbers are in the thousands, applying medium public health safety measures in the locations of concern would be prudent and improve outcomes, right? Those medium public health safety measures include things like indoor venues closed, seated dining, outdoor gatherings of 10 people. These are not the restrictions that will be in place when we get to 70%. So can you explain why you're taking a different approach from the Doherty Institute? And can you also please clarify whether the hotspot LGAs will be subjected to these medium public health safety measures when the rest of the state gets to 70% or not?
Well, firstly, can I reiterate that the roadmap that we announced is entirely consistent with the national plan and with the Doherty Institute modelling. The Doherty Institute modelling caters for regions or caters for situations where there's low case numbers, medium case numbers and high case numbers, but it also allows for localised responses. So obviously, if there is a situation in a particular community where there's a very high number of case numbers and they're increasing, you would potentially limit people's movements to within their LGA or within a city or a location, depending on where it is. But what we want is to have a reasonable reduction in case numbers by the time we open up, so that we can all move together freely, that everybody can enjoy the benefits of regional New South Wales or the benefits of Sydney without fear, in a safe way. And that's why the advice is there at any time. Health can give government advice as to whether there are locations which require additional restrictions on movement as opposed to other areas which have freedom for everybody, 70%.
Can I just follow up on that, Premier? On the most recent advice that you've received from Health, are the case numbers that we're seeing in southwestern and western Sydney in the 12 LGAs, the case numbers, does that correspond with those areas coming out of lockdown with everyone else, or would you anticipate with the case numbers where they are putting those tougher measures on those LGAs?
Well, that's why we're saying it all depends on what the case numbers are doing at the time that we open up. So when we hit 70% double dose, or when we're close to it, and everybody can follow on a daily way. So on the health tile, which many of us retweet, on that health tile, we have a daily update as to what the double dose figure is, so people can plan for when we're likely to hit 70% double dose. And at that stage, it really depends on the health advice and what case numbers are doing in particular communities. Our intention is that all of us move forward together, but if there are pockets of still high numbers of cases, fully vaccinated adults will still be able to have a meal at a restaurant or a cafe, but it might be within their local community. They might be able to go and get their hair cut, but it'll be within their local community as opposed to necessarily going all throughout New South Wales. We hope that's not the case, but we can't rule that out. It's too early. We can't speculate, and we'll just have to wait closer to that time. But the good news is that if you are fully vaccinated, 16 years and over, you will be able to enjoy the benefits of what's on that roadmap.
The other premiers at this stage about interstate borders opening up as we get closer to Christmas.
Look, obviously these conversations happen in National Cabinet on an ongoing basis, and look, New South Wales has had to confront the issues we have had before other states. And I'm confident Victoria and us will be pretty much at the same place. When Victoria hits 70% double dose, I'm hoping there will be arrangements where there will be open movement between New South Wales and Victoria when Victoria gets to that stage. They're a couple of weeks behind us, but they're also a couple of weeks behind us in perhaps experiencing the kind of peaks that we've gone through. So again, I remember when New South Wales first spoke about living with COVID and not being able to have zero cases, it was quite confronting and shocking for people. But I think now that weeks have progressed and people appreciate what that means, that other leaders are starting to also think about what life with COVID looks like. Even if you don't have any COVID cases, eventually it will come into your community.
What about Queensland, though, Premier?
Look, obviously, other states who've got close to zero cases see life differently. All I say to all of my colleagues is even when you get to 80% double dose and start opening up, you will get COVID in your community. So please accept that and get ready for that. And it could be, even then, there could be, the case numbers might be higher than we've ever seen. In fact, the Doherty report predicts that the case numbers that we'll see when we open up at 80% double dose are likely to be the highest case numbers we've ever seen in Australia. But the benefit will be that people will be protected of the vaccine. And these are very confronting concepts because until the Delta strain hit Australia in a way, we were protected. But for the outbreak in Victoria, we had been able to deal with other strains of COVID. Delta has changed all of that. And so Delta has turned on its head how we deal with COVID and how we will live with COVID. And for those reasons, I just ask all leaders to watch what's happening in New South Wales, to watch what's happening in Victoria. There was a lot of debate about New South Wales not having done the right thing, or Victoria have or haven't. But at the end of the day, Delta cuts through anything. Delta doesn't understand borders. Delta doesn't understand restrictions. Delta is a formidable, contagious, deadly disease, and we have to learn to live with it. And I think through New South Wales and the Victorian experience and the ACT, although it's a very small jurisdiction, but even in the ACT where the population is much more homogenous and much more urbanised and had high vaccination rates, even that population is seeing the challenges of living with Delta. So it's really important for us to look at the ICU capacity, and that's why, as scary as it was, we wanted everybody to know what we think, what the health experts believe the intensive care numbers will be like, what the hospitalisation rates will be like. It's really important for us to be prepared for what we'll see, because it will mean the health system will be working in a way we've never ever seen it before. We'll be seeing things unfold before our eyes that we've not seen before in Australia because of the pandemic, and we just have to prepare ourselves. And that's why I'm urging everybody to protect your loved ones, because we don't want any family, and it's horrific. I mean, I say this all the time. We mention the deaths every day, but behind every death is a whole community of loved ones. And who knows the stories where multiple people in one family might be ill, separated across a number of hospitals. You can't visit people when they have COVID. It's horrible. And we want to reduce the number of trauma and distress that families go through.
Premier, you spoke before about getting cases down to a reasonable level before we do big reopening. At no point have you ever said, what is the government or health officials considering reasonable case levels?
Well, the Doherty plan identifies three kind of scales. They say they've got a definition for low, a definition for medium, a definition for high. So our intention is always to get the case numbers as low as possible. But obviously the two figures we look at the most, and the two figures that are most relevant for us moving forward, is the vaccination rate and also what is happening in our hospital system. Can I just finish Ash's question, please? So it's really important for us to keep in mind that the balance we have to hold is never to overwhelm the health system. And that's why it's not always the case numbers you need to look at. I've often said the case numbers are there and we'll provide them every day. But what is most relevant is what proportion of your population is vaccinated, because that will tell you what is likely to happen in your hospital system and your intensive care units. And they're the figures we need to watch, because at no time can we overwhelm, well, we know that the system will be overwhelmed in October and we're planning for it and we've planned for it. But at no time do we want to see any patient not get the world-class care they're used to getting, and making sure that everybody gets the health care they need, whether they've got COVID or don't have COVID. And that's why it's really important for us to see what is happening when we start opening up, because the Doherty plan does give good direction as to what measures you can keep or put in place if your case numbers are high in a particular community at the time, medium or low, and what we do will be based on the health advice.
So, Premier, the Doherty report, right, according to what National Cabinet was briefed by Professor McBurney, says that when cases are in the tens or hundreds, you can move forward at 70% with low-level public health safety measures, but when they're in the thousands, as indicated, you need medium public health safety measures. But those medium public health safety measures will not be implemented in Sydney, right, based on your roadmap. But I guess we're just interested to find out what you see is as low as possible for these LGAs.
Well, I think it's important to note that between 70% and 80%, and definitely after 80%, the Doherty plan provides opportunities for localised responses. So the risk of restricting movement between 70 and 80% is still there, and that's what the Doherty plan focuses on. So as I said, and as we've said on a number of occasions, if there is a particular town or a particular community or a particular region or a suburb which still has very high numbers of cases...
What's that number though?
Well, there's a range which has been provided in the Doherty plan.
So is it tens to hundreds or is it thousands?
What's in the Doherty plan?
But which one is it? Is it tens to hundreds or is it thousands?
The Doherty plan has 3 scales, low, medium and high, and the New South Wales Government has based our plans on that advice, on the National Cabinet plan, on the National plan, and obviously closer to the time we'll be taking health advice as to what's happening in particular communities.
Premier, doctors and GPs are reporting a rising number of people coming forward and asking for an exemption from the vaccine, asking for a medical exemption, but there obviously aren't many conditions that doctors can provide that for. What is your advice to doctors trying to manage this, and what do you say to the people trying to get these exemptions?
Oh, I don't think we'd presume to provide any advice to our GPs. The GPs have done an outstanding role in getting communities vaccinated and also helping inform communities of what is the best choice for them. So I have complete confidence that GPs will manage those matters, that the GPs will ensure not only do they provide the base care and advice to their patients, but only provide exemptions when they're warranted.
Premier, for weeks we've seen a significant police response on the ground in West and South West Sydney. With these changes of restrictions, what's happening with Operation Stay at Home and the police response there? Are we still going to have ADF? How long are they going to be there for? And when are we going to hear from Commissioner Fuller about an update on the policing response?
Oh, look, in consultation with Commissioner Fuller and the Minister for Police, I'm pleased to advise that police believe compliance activity throughout the state is improving, although there's always, unfortunately, individuals who choose to flagrantly disregard the rules, and that's always a concern. But the best advice I've received in recent times from the Police Minister and also from the Police Commissioner is that police activity will be will be present, but obviously only where needed, and obviously the reduction in the abolition of the curfew also assisted in reducing police activity, as well as obviously the high rates of vaccination and evidence now being able to be provided if people are vaccinated or not. So I'm sure the police will provide updates on their activity, but having spoken directly to the Commissioner and also the Minister last week, I was heartened by police responses and reports And even yesterday could have been a horrible day with lots of people out protesting, and we didn't see that. So I'm hoping people are getting the message that we are all in this together, that we want to support one another and come out of this as safely as possible. And I think all of us can see that glimmer of hope and the light at the end of the tunnel, and all of us want to support each other during this time. But my biggest thanks today must go to the communities of Western and South Western Sydney. Their high vaccination rates have given us that confidence to move forward in a positive way, and also confidence that we have an opportunity to move together as a state when we hit that 70% double dose.
Dr. McIntyre, we're hearing from positive cases who never actually get to hear from New South Wales Health, also close contacts who never receive their release text messages despite testing negative. Some people are saying they've been stuck in isolation for up to a month. Is New South Wales Health being swamped?
So yeah, we recognise there has been some issues with getting to all patients and contacts, and so by working with police and clinicians across LHDs, we've been making sure that patients have some contact and some advice, including to their household. So, for example, police will visit cases, provide information, do a welfare check, and provide information for the other people in the household about their need to isolate. Similarly, the clinical teams in the LHDs have a program of following up on cases in the community to check on their wellbeing and assess them. And in public health, we work in that group to try and get as quickly as possible to all cases to check on them. But there have been issues as the numbers have increased in giving release information to patients. So if patients are in that situation, we ask that they contact their GP or local health district to get updated advice.
How bad
we
is
appreciate that.
How bad is it though?
Well, we understand that through either the police, the local health district clinical teams, or the contact tracing, we're getting to just about all cases on the day, but there are some delays in releasing people. So we're working through that urgently to make sure people are released as soon as possible.
Dr. McAnulty, the Premier just said that ICU is yet to see, is yet to hit its worst, and of course restrictions are easing mid-next month. What reassurance can you give to the public that the health system, that New South Wales Government and New South Wales Health will ensure the health system doesn't become overwhelmed? Because that does sound quite alarming to a lot of people.
So there's been an enormous amount of planning being done across the health system, led by intensive care specialists and other medical specialists, to make sure that, working with planners, to make sure that the system will cope. It will be very stretched, as has been mentioned earlier, as this is a pandemic and we've seen what's happened overseas, but there's been an enormous amount of planning being done to care for people in an optimal way.
What about seeking assistance from other states? Is that something that's been ruled out? Or?
I'm not across those details, I'm sorry.
Doctor, do you have any information about a small cluster of cases in
I don't specifically. We'll have to get some details after you. So we have a number of clusters around the city, of course, at any one time. We're seeing outbreaks in workplaces, we've mentioned before, and a number of areas across the city, particularly in southwestern and western Sydney, but also in the inner city.
And just on pools, what was the specific, on pools, public pools, what was the specific change in the health advice that meant between Monday and today, which meant that pools could reopen? What was the specific change there?
I can't give you the specific advice, I wasn't part of the conversation, but we do know that pools, outdoor recreation, are very important, and the important thing is that for any business where people are congregating, that they've got a very carefully developed COVID safety plan to ensure that there's those things that promote the spread of COVID, such as gathering together in change rooms, in other sort of settings, minimised to keep people safe at all times.
Can I just clarify that the swimming pools, indoor swimming pools, are not able to reopen? Indoor swimming pools versus outdoor swimming pools? What's reopening?
Sorry. Premier.
Thank you. The advice we received was in relation to public pools, and there'll be COVID safety plans provided, and obviously there'll be some areas of grey, but we're hoping to make it as black as white as possible. So that's why we've delayed the implementation till the 27th, so Monday week, and Health will ensure it puts out a COVID safety plan so that all managers of public pools across the state will be able to follow that COVID safety plan. Oh, look, there was obviously health was keen to have a few more days of seeing what the case numbers were doing, especially in those areas of concern. And we're very keen to make sure that whenever we relax anything moving forward, that it applies to everybody across the board. And so when health provided us an update to say that they were not comfortable by any stretch, but more comforted by the couple of days of non-escalation in cases in those areas of concern, that they had a sufficient degree of comfort, coupled with the high rates of vaccination, coupled with the way in which you can manage those environments in terms of separating out areas and having rules around change rooms and all those things, and the warmer weather outdoors. So there'll be a detailed opportunity for all managers of public pools in the main. There'll be councils and other owners will be able to look at those plans, adhere to them, and make sure they're well communicated.
Last question.
We understand that Health is reviewing the staffing around ICUs following discussions with the Health Minister and frontline nurses. Can you give us some more concrete detail on what that means and what's going to be put in place to support these workers who are really going to be sort of carrying states back during October? Oh
no, the health workers have been carrying our back since the beginning of the pandemic. But as you might recall, it feels like a couple of weeks ago when Dr. Nguyen, who is one of the specialists, the emergency doctors and clinicians and intensivists who outlined in detail the plans that we've been preparing, or I should say the health system has been preparing in excess of 18 months. So those plans have already started to kick in. And we made sure as a government that we used the language the clinicians used in describing the situation. So the clinicians used the language that in October there could be several weeks where the system is technically overwhelmed. That is the language they use, and that is the language we kept to make sure the public appreciated that when we get to that stage in October, it means that ICU units will look different. Other parts of a hospital might be an intensive care unit. Hospitals will be sharing around the load. Staff who've been retrained and re-skilled will be stepping up. So there's a whole range of measures that are going into place already, and Dr. Nguyen highlighted those. I want to assure the community that those plans have been worked up, worked on, implemented over a period of 18 months. So ordinarily our hospital ICU capacity would have been around 530 odd beds. We now have a surge capacity of 1,550. That includes staffed beds, and that's really important to note. And that's why we always have to keep an eye on what is the likely number of people who are going to require ICU. We certainly don't want it to get anywhere near that 1,550 number. But I do want to stress that when we get to those weeks in October, we are going to see things we've never seen before in our hospital system. We're going to see images, we're going to see practices, we're going to see things done differently, because our system will never have to cope with the likes of that again, we hope. And that's why we have to be really careful when we start opening up, because we don't want to see the system overwhelmed. It's the higher rates of vaccination that we know keep people out of hospital. And whilst the case numbers don't matter, if you're unvaccinated, it does matter, because you're more likely to end up in hospital or an ICU bed. And it's really important for us to keep people safe. And as time goes on, and as we open up and the number of cases go up, as I said, the figure to look at is the ICU capacity, but we also have to accept that even if people are fully vaccinated, if they're vulnerable or have underlying conditions, they still could succumb to the disease. And we just have to be extra cautious when we open up.
Premier, there's been a lot of concern and criticism that the harsher restrictions in the 12 LGAs created a lot of division and animosity and divided the city. Do you stand by the approach that was taken, and do you think it was worth it?
Look, I absolutely stand by the approach it's taken, as difficult as it was, because the other option is, we always said that we didn't want to burden our citizens unless we absolutely had to. So it was actually the least worst option. The other option was to have those measures across the whole city or the whole state, when in hindsight we may not have needed to. So I can appreciate how people feel like that. But we've just followed the stats. We've just done what we've needed to do. And when I look back now, it's too early to make assessments on what happened and what didn't happen, but I think it's really interesting to see for how long New South Wales remained around that 200 case number. So for those weeks that we're able to keep those case numbers so low has prevented us from having doubling or tripling of case numbers as we've seen in other places. So every week has been a battle to keep the numbers as low as we can until we got those vaccination rates up. Now in those areas of concern, we're less worried because we've got high rates of vaccination amongst the most vulnerable, and we are, when I say most vulnerable, I mean in communities where there is high circulation of disease. So we're so pleased that the targeted vaccination strategy is having a positive impact on the vaccination rates, but also on where the cases are at the moment and the likelihood of someone requiring intensive care. So of course it's been difficult, and of course I wish we didn't have to do any of it. Some of my hardest days in the job are days when you take away people's freedoms, when you subject them to horrific situations. It's the least pleasant of anything you have to do as a leader. But you have to do that based on the advice and what's best for the community. And it's too early to say to what extent we've been successful or otherwise, but I do know that we've prevented thousands of hospitalisations and potentially thousands of deaths. And that's what our intention was until we got those high rates of vaccination. Now, moving forward, that remains our big concern. We do want to prevent people ending up in hospital or worse, and that's why those high rates of vaccination are really critical, but also opening up safely is really, really important.
Last question.
That's it. Great. Thanks, everybody.